We are now moving on to our next session by Dr. Uma Nambiar. Dr. Uma Nambiar is an international healthcare consultant with considerable understanding of the Indian, African, and Sri Lankan healthcare systems. A trained neurosurgeon and a well experienced hospital administrator, she specializes in strategic planning and implementation, review and design of healthcare policies, plan and commissioning of new hospitals, process standardization and quality in the healthcare system, as well as use of information technology in healthcare. A passionate believer in digital health systems, being an enabler of accessible, ethical, and affordable healthcare, she devotes considerable amount of her energy and time to promote its implementation at all levels in the ecosystem. Please welcome Dr. Nambiar.
Hi, good evening, everyone. Actually, I'm on the road. I'm just trying to find a good parking spot. So, first of all, let me thank you for inviting me to this webinar and a series on the future of healthcare, and especially the learnings from the COVID that we've had. So I just want to start with, all of us know that the complexity of the healthcare, how complex the healthcare is. And this is something that we always thought that we had it in control. But, and also, if there's a complexity, if I were to extend it to a patient's complete life, from cradle to grave, there are many events that happen in a patient's life which are either related to wellness or illness, and therein lies the complexity. And all of us, we really thought, before COVID, that we had it in control. That's the sort of view that most of us had, and all of us thought that we were completely comfortable with the way we were managing our healthcare, until we realized that this old model that we thought we had in control really failed us when our vulnerability of our human nature as well as the contemporary healthcare system was exposed. And we really, in that time when we were hit unawares by COVID, the entire chaos, turmoil, and confusion that we all witnessed has been unprecedented, unparalleled till by any other event or catastrophe that we have seen in our lifetimes, or at least in the last 100 years. So it really took us by surprise. And it also made us realize that the pre-COVID healthcare system, which we thought was so robust and we were so much on top of it, at least we believed, we realized how fragmented the system is, how we relied so much on event-based reactionary responses to really take care of the patients and manage the entire system. We thought we had good crisis management models until such time that this crisis we faced, we realized that we didn't have anything to help us. It also made us realize how self-centered all our healthcare systems were, how individualistic or provider-centric they were. And we literally had to pay a price for failing to digitize at a time when this would have helped us. So for which the responsibility squarely lies on all of us in the healthcare system, where we were so resistant to this new change or adopting digital technologies, which have been around us for the last 18 to 20 years, but we just somehow were so reluctant. And typically every healthcare organization likes to work in silos and does not like to share information. But things changed during COVID. In a desperate bid for the humankind to survive, we were ready to set aside our differences. In that whole chaotic ecosystem, when we realized our supply chain systems failed us, because suddenly we all became so self-centered that we would not share our supplies. At one time, we were so happy to export all our drugs and consumables to any other place. In the trade between countries came to an abrupt stop. Suddenly you didn't have drugs available, you didn't have consumables available. The patients could not cross borders. Typically medical tourism industry came to a stop. And the performances of hospitals, whereas on the one hand there were hospitals which made millions, I mean they made great business. On the other hand, there were hospitals, and small and big alike, they literally had to shut shop. They just did not know, they couldn't get their act together. And the failure to collaborate and an inclusive participation before this led to this, collapse of the hospitals. The one who could collaborate with, even with different hospitals, they managed to survive. The ones that had digitization in place, the one that could do telemedicine, that could depend on digital technology, they survived, they thrived, in fact. And in this entire scenario, what really saved us was digital technologies and a quick adoption. And I want to bring here to everyone's notice that telemedicine, which has been, in fact, even in India, I think it's been in practice for the last 20 years, but nobody ever adopted it. Immediately when COVID happened, the government, brought about this telemedicine practice guidelines so that the practice of telemedicine could be legalized. Doctors or hospitals could charge for it, and the advice could be legalized, and that really saved the day for a lot of patients, for a lot of hospitals, all of us. In genomics, global coordination of research, newer methodologies to develop vaccine, all this was because of rapid advancement in technology and an inclusive participation across the globe with a single point agenda that we need to control COVID. So typically, if COVID spread so rapidly because the globe is, such a shrunk space now and it's such a, unit entity, the development of vaccines also happened because the world is so small and globally it's so easy to communicate. So this also, this was something which technology made happen. So the realization also dawned that in future, if the models that are emerging in healthcare, the major driver of the new model of the ecosystem is going to be technology. And I refer here particularly to digital technology. So adoption to these emerging digital technologies is going to be the key to survival. And what we have all along resisted, this change to digitization, especially in the healthcare workforce, the entire, resistance to change, many times it's because of the fear of the unknown, and none of our workforce, the doctors and the nurses and anybody during their training has any significant training in digital technologies or use of the same. So therefore there is a resistance because we don't know what we're dealing with. And of course, there used to be a myth that if we do telemedicine, it dehumanizes care. But I think that myth has been busted right royal, and patients as well as doctors have realized that it is no longer true. So in future, the healthcare has to be modeled by, a digitized data analysis. So it's going to be, future is based on collection of data and research using technology, and no longer in physicians' mind and physicians' discussions in small groups. So we realize that you need, the data input sources are going to be the EMRs, the electronic medical records, the hospital information systems, the various equipments that generate data in terms of radiology images, the lab images, and a lot of other tests, devices that are available to us, which could be wearable, non-wearable, and apps that people are using left, right, and center, and every day you see a new app coming into the market. So all of them will generate data, and this will be organized, analyzed, and using AI will also be used to provide predictive and personalized care, ensuring a continuum of care in a patient's lifetime. Typically, a longitudinal record of patients' events and wellness-related data which will be at the same place and under control of the patient. And this is the kind of care that we will have because of technology putting together all this information and analyzing and making it intelligible decision support backbone for a doctor to provide better and better care. And that's what we see is going to happen in the future. So if you have in the last 10 years come across terminologies like electronic health record, mHealth, telemedicine, kiosks and remote monitoring tools and sensors, wireless communication, you will find more and more of them evolving. And although for these technologies, it has taken the last 2 years for all of them to literally get telescoped in the enhancement of usage, you'll find that what we are going to see in future is the push on data-driven healthcare. Advances in telehealth, where you'll have tele-ICU, telepathology, teleophthalmology, which has already started, which has started emerging, but these will emerge as very strong building blocks. In fact, telemedicine, the basic telemedicine application, will become equivalent to in a brick and mortar system, you have a PHC, whereas a telehealth ecosystem will actually become a building block to the basic data collection, which might even be in patients' homes. And that is what is going to happen. So we will have, although the physical model, the brick and mortar structure will be remaining, will be there, and there will be a large use for the brick and mortar structure. That's very, very important. So we will have blockchain technology, AI, 3D printing. I mean, 3D printing of organs, people have already started. So this will become more and more common. And all of this, and there are so many more technologies. You'll have the series of healthcare assistants, like doctors will we'll have wearables, and today we have sensors, but we'll have purpose-driven sensors and personalized medicine. So all this will get telescoped in much less than the next 5 years. So this is something we have to be ready for. We have to be ready to adopt to this. So in the post-COVID scenario, what have we learned and what do we think is the future? And if we have to really not face with a catastrophe that we faced 2 years ago, we need to be ready to focus on wellness rather than on disease. We need to focus on
Dr.
population
Uma,
rather than, yes.
your slides are not moving. I mean, they're kind of frozen. So it's on the first page itself. Yeah.
Oh, I wish you told me earlier. So can I just quickly rush through? These are the slides. Okay.
Sure.
And I will. So we mentioned about technology as it came to our use and the need for adopting digital technology and the data sets that are the future of healthcare, how we will analyze data using technology and rather than just the physicians, individual physicians' mind power alone. And we discussed about the various technologies that are going to see a very telescoped adoption and growth in the next 5 years. And we were on this discussion of what will happen in this scenario when we are through with COVID. So we are literally in our battle with COVID. I would say that we are almost there. And although we still cannot say that we've completely covered it, but what will happen is that we need to, and the learnings that have been, is that we no longer can have just a single disease-based focus. We need to start looking at wellness. We need to start investing in wellness. We need to start investing in the health of the population rather than focusing on a patient alone. And that's where, digital technologies will help us immensely. The analysis of population-based data, the policies that we are going to form because of that, and the investment that we will do. Similarly, from the fragmented and episodic focused approach to illnesses, we need to start looking at continuity of care for a patient. Patients are mobile, patients have multiple episodes of illness, patients go to multiple healthcare centers, and we also need to amalgamate the data of illness and wellness together, and therefore be able to provide predictive care to the patients, and therefore stop being reactive and use the data intelligently to be able to provide preventive, predictive, and proactive care. As we are discussing, newer care models are emerging. We have seen, as I discussed earlier, that COVID really did result in near bankruptcy of many hospitals, many small hospitals, many large hospitals, many individual healthcare providers could not sustain the onslaught that resulted from this pandemic. Now, we cannot afford most of these organizations to just die out, because on the one hand, we say that we don't have enough hospitals, enough beds, and enough doctors to look after patients. And there we have hospitals which are going to be in the need for revival. So we need to revive these units, look at newer business models and financial models to see how these units can be helped, how these units can be revived. And we need to also look at newer models of primary care. Now, we suffered majorly in the last 2 years because our care approach was always towards tertiary care. You know, when we were making any hospitals, tertiary care, secondary, tertiary. The private investment into private primary care has been really very, very minimal. And what we must understand is primary care and wellness, which means keeping patients away from falling sick and away from the tertiary care units, is where there is value that you unlock in human capital, and that value needs to be unlocked. And that's where, and that's the only thing that's going to help us in epidemics like this or episodes like this. So what will be the impact of digitization on care providing system? One is the processes will get re-engineered. We will be able to do revival models for the hospitals that have not been able to sustain themselves. There will be a newer category of workforce that will emerge. So we'll have newer workforce, newer job categories. People will also expect job categories with a lesser burnout. And I think those opportunities need to be provided. And we need to have technology assist the doctors and nurses to prevent the burnout which they face these days and the kind of stress that they have undergone. Of course, we are looking at big data opportunities and value-based payment models when digitization happens. So the care providing system stands to gain. Similarly, how would the patient gain? Promotion of well-being. So well-being in an individual is what people look for. See, but none of us is looking to fall ill and use the hospital. We would rather remain well all our life and not have to visit the hospital. So patients will welcome that approach. Participative decision-making, where patient has information about the disease, the management, and is an equal partner in the decision-making. Similarly, an opportunity to purchase personalized medicine and to have connected care, which is in the control of the patient. Similarly, the technology developers and equipment manufacturers, the opportunity for them to enable accurate data capture, opportunity for them to get seamless or to develop seamless exchange of data through interoperability. And similarly, of course, they will need to ensure compliance to the guidelines developed by the government. I mean, we know that Indian government is rapidly developing newer and newer guidelines, and our technology has to be ready to implement them as they come and to adopt very seriously and be responsible for all that. There will be a huge impact on cost reduction. Use of artificial and augmented intelligence will be able to give predictive analytics. So therefore, reduction on waste of healthcare. And I say waste of healthcare as in when you standardize, and we have this one size fits all kind of a treatment approach, and we generalize things, you realize that, we are thinking one of them will be a magic bullet, but a whole lot of the other things will be a wasteful expenditure to the patient as well as to the healthcare system per se. Whereas if you if you can predict the exact treatment for a particular patient, the exactness of the treatment that you give will reduce the waste that you will otherwise would have indulged in. And therefore the customization of care. promotion of wellness we already mentioned, will reduce cost of acute hospitalization. So the acute events in any patient's life is what really makes them miserable, drives so many patients below poverty line in the country on a regular basis. And promotion of wellness costs a fraction of the management of an acute event. The other reason that will, what will reduce the cost of treatment is reduction of travel from a tier 3, tier 2 town to a tier 1 town where the facilities exist. You can, through telehealth ecosystems, provide access to patients in the remotest parts of the country. It could be tier 3, tier 4 town, even small villages. And patients can have doctors consulting from tier 2 cities, or even globally from where any of the large hospitals. The rural population in India could benefit, or anywhere in the globe for that matter. And reduce duplicity of data. The lab reports that are done, like somebody comes from Bihar or Jharkhand and comes to Delhi, the tendency is to redo all the reports, because we don't have those reports available, patient is not carrying them, they're not legible, and so on and so forth. But if we are working in a connected system, then those reports are available to the doctor in Delhi from the tele system through which the patient is connected. And therefore, they can advise the patient the right approach and whether the patient even needs to travel to a city. So that is something that will also reduce cost of travel a lot, because we've seen today that people who come from villages and smaller towns, they spend weeks and weeks in big cities to even get an appointment of a doctor or to even get admitted. So these costs we have to reduce. Now, I'm sure all of you in the forum today would have heard of Ayushman Bharat Digital Health Mission, which was rolled out by the Prime Minister a month ago. And it's a forerunner of the National Digital Health Mission, which was rolled out last year, and before that, the National Digital Health Blueprint, which was first published in 2017. But now we can say that Digital Health Mission in India has truly arrived. And if I was to say, I think this is one of the most ambitious and daring projects any government anywhere in the world could have taken. And if there is one policy initiative which is launched in the 21st century in India, which is going to be the major game changer for our country and for and a large part of the globe, because I can see people who are going to follow what India is doing. And so this is one policy. I don't think any other policy of the government will have this much impact as this will have, because this is putting the health of the citizens in their own hand. It is focusing on data management. See, healthcare is about managing data, even conventionally. What do the doctors do? They manage the data, they have input data. And so they have the data that, the input is from examining the patient and taking history, and the process in the doctor's mind, and the output is the prescription or the management. So this is going to be done by technology. So that's major impact that Ayushman Bharat Digital Health Management Mission is going to have. So if you see the whole purpose of digital health ecosystem, how it will work, is seamless delivery of healthcare across the country to all citizens. It's bringing healthcare to the citizen rather than the citizen having to go to the healthcare provider in most instances. And that's a major impact that we can see, and we can expect that in the next, say, maybe 5 years, this would have made major strides. And the patient of tomorrow, I would like to call that patient as an e-patient, which is an engaged patient, an empowered patient, and an equal patient. An equal because information that the patient has is a great leveler. And that with that information, the doctors have to engage with them through technology as a team player. And that's how in future we can expect healthcare to be delivered. So we need to, as healthcare providers, be ready for this change that will happen. So whether it is by building capacity, learning ourselves, and understanding what is required, but we need to be ready to be able to do that. And we can expect both clinical as well as business transformation through this method of data management. And it will also require cultural transformation, as I mentioned, about changing our attitudes and mindsets, and how we need to be ready for future. But transformations don't happen in a vacuum. They require an appropriate financing models. And what we need is public financing, private financing, or collaborative public-private funding together, but not in the return of investment model or a quick ROI model as we see today. But for healthcare, we need to look at social impact funding, which is a long-term, which can visualize a long-term ROI, which understands that healthcare is not a quick, game of quick returns, which understands that breaking even and getting profitability in healthcare takes time, which also should understand that profitability in healthcare needs to be measured not just in terms of finance, but also in terms of goodwill, in terms of social impact, and all of that together. And those kind of financing models need to be developed by the pundits that are in the finance sector. So if I was to conclude, I would say that we need to be prepared for this changing world by embracing technology with an open mind, innovate new financial and business models, and of course, be self-preservationist without being self-centered. Because if we don't do this, and if we are not readying ourselves for the future, then it will not be difficult. It will not be easy for us to survive. Forget about thriving, because we will all perish in the aftermath of what has, been actually shown to us as COVID, as a glaring deficiency of our conventional healthcare system and the way we were managing healthcare before. So we need to really embrace what is going to happen. And that is what I want to tell you today, that we need to be open about it. We need to be very, very, I would say, open to learning, because we should not close our minds to learning new things. And whatever be the age, it doesn't matter. So that's, so with that, I want to thank you again. And if there are any questions, I'm open to taking it. I'm sorry, I'm in a car, so there might have been some disturbances, but my apologies for that.
And thank you for such a wonderful session, Dr. Uma. It was really great to, get to know insights from you on this topic. It has been very fascinating. Thank you so much for your time.